Hi, my name is Shirley de la Cruz. I medical English C1. I am to talk about is the summary of the video of immunotherapy in renal cells, the carcinoma, and ribavirin for the chronic hepatitis E virus infections in transplant recipients. Definition: immunotherapy is the use of the drugs to boost a person's immune system. Hepatitis E is a viral infection that causes the inflammation and damage to the life. The inflammation is the swelling that occurs when the tissues in the body are injured or infect. Inflammation can damage organs. Some the times are the spread, the breathe, the drink, the contamination, the water.
What if you could supercharge the immune system and use it to fight cancer? Immune cells keep your body healthy by identifying and destroying cells that can cause you harm. But cancer is often disguised as healthy cells, allowing them to grow into dangerous tumors undetected by the immune system. At University of Minnesota Health, in partnership with researchers at Masonic Cancer Center, we're developing a technique to help immune cells seek out and destroy cancer. This approach to cancer treatment, known as immunotherapy, is a precise treatment that targets cancer cells while ignoring healthy cells. Now, in clinical trials, we're treating leukemia patients by removing immune cells, activating them in a lab, and giving those natural killer cells the key to recognizing and destroying cancer. When the superpowered immune cells are injected back into the patient, they begin their search and destroy mission, finding cancer cells and killing them on the spot. For some patients, it's like a magic bullet that kills cancer, and the whole process looks like a simple blood transfusion. We're reinventing cancer care, and it's happening right here at University of Minnesota Health. Available at 6 different locations in the metro area.
Application in medicine. An important feature of the immune system is its ability to prevent itself from attacking normal cells in the body. To do this, it is used the checkpoint, which are the proteins in immune cells that need to be activity or disactivity to inactivity that an immune response. The virus is excreted in the phase of in the fact the people on the enters the human the body through the intestine. The contagion occurs the mainly through the consumption of the contaminated drink the water. The infections usually resolve spontaneously and clears up the winter choose to the 6 weekends.
Hepatitis E is RNA virus. Spread by the fecal-oral route. Incubation period 3 to 8 weeks. Common in Central and Southeast Asia, North and West Africa, and in Mexico. Causes a similar disease to hepatitis A, but carries a significant mortality, about 20% during pregnancy. In general, hepatitis E is a self-limiting viral infection followed by recovery. Prolonged viremia or fecal shedding are unusual. In acute infection, IgM antibodies to hepatitis E virus are positive. Does not usually cause chronic disease. A vaccine is currently in development, but is not yet in widespread use. Thank you for watching. For more videos, subscribe.
Pros and cons. Cons. Some effects are the tiredness, diarrhea, high blood pressure, skin rash or blisters, the cough, the shortness of the breath or abdominal pain. The pros. The immune system helps the body fight infection and other diseases. It is made up of the white blood cells and organs and tissues of the lymphatic system. Cons. In rare cases, acute hepatitis E can be severe and lead to fulminant hepatitis. These patients are at a risk of death. Pro. The possible benefits with the use of the ribavirin in chronic infections.
So the next wave is these checkpoint inhibitors. There's at least 4 or 5 trials that I know of. I think only one with atezolizumab that's actually up and running. Others with nivolumab and durvalumab, and also, any drug you can imagine will be tested in that setting. It probably makes a lot more sense. It's going to be better tolerated for patients, I think. I think probably has the potential to extend overall survival, which would be ideal, which we haven't done to date, even with S-TRAC. And so we'll have those results in many years, but I think probably if we're sitting here in 5 to 10 years, we'll be talking about those drugs as standard of care.
You should apply it in Ecuador. Kidney cancer remains one of the most common tumors worldwide, causing more than 114 million deaths a year worldwide, and renal cell carcinoma accounts for the 90% of all cases. It is estimated that each year that there are about 20 million cases of the hepatitis E infection of the with the 3.3 million shows symptoms of the disease.
So now let's meet some patients so we can put to work what we have learned about hepatitis E diagnostics. Our first patient is Hannah. She feels sick and had to vomit at home. She's feverish and her skin has a yellowish color. Her symptoms started 1 week ago. 4 weeks ago, she came back from Mexico when she visited family. Obviously, we think about hepatitis. Let's order lab tests. In Hannah's lab report, we can see that her liver enzyme function is significantly elevated. Furthermore, her hepatitis E tests are positive. Hepatitis E RNA is also detectable. So what's your diagnosis? Hannah has no history of immunosuppression. So let's take a look back at the graphic dealing with immunocompetent patients. Her ALT is very high, which signifies serious liver damage. Anti-HEV IgM and IgG are both positive, and we could detect RNA in Hannah's stool. Based on these results, we can conclude that Hannah is most likely in the early phase after infection. So Hannah is suffering from an acute hepatitis E infection. Let's see our next patient. Our second patient is Pete. He suffers from abdominal pain of recent onset. In the lab report, we can already see elevated liver enzymes. Pete received a lung transplant 8 years ago. Currently, he is on immunosuppressive therapy. Furthermore, he tells us that he's a passionate hunter. Based on Pete's history, we include hepatitis E screening in our lab report. We can see that his liver enzyme function is significantly elevated. His anti-HEV antibodies are negative. However, the lab detected HEV RNA in Pete's stool. What does that mean? Since we know that Pete is taking immunosuppressive medication, we should consider this in interpreting his lab results. We know that immunocompromised patients can have problems producing antibodies to the virus. So in Pete's case, it is essential to measure RNA. His lab report shows elevated ALT levels as a sign of liver damage, but negative antibody tests. However, there is RNA detectable in his stool. Pete is suffering from an active, ongoing HEV infection. Based on the laboratory findings, we cannot determine when Pete was infected. It may have been recently or more than 6 months ago. However, it is not important to know that. What is important is that Pete gets appropriate treatment and follow-ups. Congratulations! Now you can handle hepatitis E lab results.
Conclusion. In conclusion, I consider that the both are these that can cause serious damages to your organs. I also think that immunotherapy is very important as it is strengthens the person's immune system and can learn used to and which one of the most harmful these the such as cancer.
So the things are clearly evolving for several years now, but especially since last ESMO, where we had the results of nivolumab versus everolimus randomized phase 3 study, which demonstrated that in patients who fail 1 or 2 VEGF-targeted therapy, there is a role for IO, immuno-oncology, and namely nivolumab. It is important because this is changing one of our standard of care, and since last year, this has been implemented in all the guidelines. What is important at this ESMO is that we're starting to have more information on which will be the next step in terms of combining those agents, for instance.